This animation is designed to educate you about the prostate gland, where it's situated in the body and its function. Only men have a prostate gland. The prostate is situated in the pelvis, just below the bladder, and in young males is about the size of a plum. The prostate gland is responsible for the production of fluid for ejaculation. The prostate is situated deep in the pelvis, just behind the pubic bone. At the base of the pelvis, going from the pubic bone to the tailbone, is a hammock of muscle supporting all of the pelvic organs called the pelvic floor muscle. This muscle is very important in maintaining continence. Sperm is produced in the testes and transported along the vas deferens. The seminal vesicles sit behind and within the prostate. Fluid is stored here until the time of ejaculation. Urine is produced in the kidneys and travels down the ureters to the bladder where it's stored. When urinating, the urine passes from the bladder along the urethra through the prostate and the penis. As you can see, the prostate sits just beneath the bladder. The rectum, or back passage, is situated just behind the prostate. This is why the digital exam of the prostate is done via feeling the prostate from the rectum. The nerves responsible for erections wrap around the outside of the prostate. Part of the pelvic floor involves a band of muscle which surrounds the urethra, which is called a sphincter. This sphincter is responsible for continence. The urethra is seen here, passing through the prostate. The nerves responsible for erections are within very fine layers of tissue surrounding the prostate called the fascia. The bladder gradually fills with urine produced by the kidneys. The sphincter acts as a valve, preventing leakage. As the bladder fills, a sensation of needing to pass urine is created. The urinary sphincter continues to prevent leakage until it's convenient and appropriate to pass urine. At the time of passing urine, the bladder contracts and the sphincter relaxes in a coordinated fashion, allowing urine to flow down the urethra. Along the zones of the prostate gland are the transition zone surrounding the urethra and the outer peripheral zone. In all men, the transition zone enlarges over time. The process of enlargement is not related to prostate cancer and is a normal part of aging. This enlargement may compress the urethra, making it more difficult to pass urine. The result is that men may find they need to get up at night to pass urine. They may go more frequently, have a poor flow, need to rush to the bathroom, and may feel that they have not completely emptied their bladder. Most prostate cancers develop in the peripheral zone, well away from the urethra, and therefore do not tend to cause any urinary symptoms. The role of the prostate is to produce part of the fluid for ejaculation. At the time of orgasm, the sperm and all fluid for ejaculation passes through the channels within the prostate and into the urethra.